So we're talking about some two abnormalities this evening. This is the lateral cystocele and the paravaginal defects. Lateral cystocele and paravaginal defects. So what's a cystocele? Cystocele is just simply the bladder is kind of like trying to collapse into another structure. You understand? So there are actually types of pelvic organ prolapse. So each of the conditions just simply means that the organs from up are trying to fall down. Okay. So they involve the anterior vaginal wall typically because of the weakening or detached structures, okay, of the bladder and vagina. So the cystocele occurs when the bladder bulges into the vaginal wall because the pelvic muscles they are becoming weak. You understand? So we have different types of cystoceles. We have the central cystocele. Okay, that one is a midline defect. Then the lateral cystocele is detachment of the pubocervical fascia from the arcus, tendineus, fascia, pelvis, right? So paravaginal defect is a specific type of lateral cystocele where the vagina separates from its lateral attachment, causing descent of the anterior vaginal wall and the bladder. Okay. So for all of them, symptoms is what the vagina is bulging or a whole lot of pressure, urinary incontinence or difficulties emptying the bladder, recurrent urinary tract infections, sexually dysfunctions or discomfort. So for all of this, if you want to diagnose it, is simple. You just have to do pelvic examinations. All right, then MRIs, okay, then urodynamic studies. So treatment is pelvic floor exercises, pessaries, okay, surgery for paravaginal repair, okay, can be done via vaginal approach, abdominal approach, or laparoscopy. So you have things like corporaphy, okay, where they try to repair or stitch all those defects so that they can strengthen the pelvic floor muscles. Then also they could actually augment using a mesh. Okay, they can also augment using a mesh. Okay, so that's what we have for this.